Microabrasion is a procedure that can produce immediate and long-lasting improvements in the appearance for patients with enamel discolorations. Perhaps the most crucial factor in achieving a successful outcome with microabrasion is proper case selection. Two clinical techniques for determining the location and depth of a tooth discoloration will be presented in order to screen patients for microabrasion treatment. First, the location of the discoloration within the tooth must be determined. Discolorations located on the surface of the tooth are more easily removed with microabrasion. Discolorations that are on the surface of the tooth will typically appear opaque with defined borders. Discolorations deeper within the tooth will appear murky with poorly defined borders. If the tooth is viewed from its side, surface lesions will show a sharp, opaque edge, whereas deeper lesions will show a translucent, murky edge. Here is an example of a murky, poorly defined discoloration. When viewed from the side, the discoloration appears to be behind a layer of enamel. This can be observed as seen on the edge of the tooth, which shows a translucent, murky appearance at the area of the discoloration. Here is an example of an opaque, well-defined discoloration. When viewed from its side, the edge of the tooth shows an opaque appearance at the area of the discoloration. Aside from the location of the discoloration within the tooth, the depth of the discoloration should also be determined. A deeper lesion will be more difficult to remove as microabrasion removes 25 to 100 microns of enamel. If an LED curing light is directed through the lingual of a tooth, a shallow discoloration will allow some light to transmit through the tooth. A thicker discoloration will block light and appear as a well-defined dark area following transillumination. Here is an example of a thick discoloration showing a well-defined dark area with transillumination. When that tooth was sectioned, the discoloration was 450 microns thick. This amount of enamel would not be removed with microabrasion. Here is another discoloration. The white stain allows light transmission, which indicates that it is a superficial discoloration. When that tooth is cross-sectioned, the discoloration is only 35 microns thick, which could easily be treated with microabrasion.